Hi, I'm Ritika Aggarwal. I'm a consultant psychologist with Jaslok Hospital. I would first like to take this opportunity to thank the Mompreneur Circle for this beautiful initiative of creating awareness for mental health. Today we're going to talk about what parents can do to help children with depression. So to start off, I would like to start off with talking about what feedback I've got so far from children when they come in for therapy. The primary concern is that they feel no one's taking them seriously. It's taken a long time for them first to maybe open up to parents, convince parents, friends, family that there actually is an issue, and then look for a therapist and finally start. So they feel that a lot of times in the start their feelings have been invalidated because someone has said, it's just in your head, get over it, it's not that difficult, just think positive. So all of these things kind of make them feel that maybe what they are thinking or feeling is wrong, and in that process they tend to go more into their own shells. This can create further issues for them. So first off, let's start off with trying to create an open environment where children can come and talk to us openly. Let's try and have a non-judgmental conversation with them. So when they come and say, Mom, I'm not feeling that great, or today so and so said this and I'm really upset about it, rather than saying just deal with it, come on, grow up, let's try and say, okay, why did you feel that way, what can we do about it? So try and make it more inclusive rather than something they should have done or should have done differently or correctly in that sense. So validate their feelings and thoughts, and most importantly avoid comparison with friends, family, siblings, anybody. Usually the tendency is, but your friend went through the same thing, so what is the big deal? Why are you making such a big deal out of it? Again, it hurts their feelings. Sometimes what parents may also do is that so and so went through the same situation as you, they are fine, they've dealt with it, why can't you deal with it? Depression has different causes. Not everyone going through the exact same experience will develop depression. So now next, once we've identified that we need to create an open communication so that we're also looking at prevention, not just treatment, let's try and identify what are the signs and symptoms of depression. Now, children may present it differently as compared to us adults, primarily because the younger children may not understand what they're feeling. So if you don't understand what you're feeling, how do you express it to your family? How do you express it to friends? So it might come across more as irritability, just anger outbursts for no reason, withdrawal for no reason. With teenagers, it might be considered, this is just the usual teenagers. It's just their usual angst which they're going through. It might also be mistaken for, in both ages, as either laziness or misbehavior. So now how do we identify that this is what we are looking at? So one is, if you remember, that they have low frustration tolerance in general. So now this is going to go even lower when you're looking at depression. You might find a drop suddenly in academic grades. You might find difficulty making decisions, difficulty accepting changes, difficulty making simple choices, falling sick more often because depression reduces your immunity system. You might find more aches and pains, which may or may not have, which usually don't have a physical symptomology. They might be extremely sensitive to criticism. So the smallest thing which you normally would have said and would have just been, okay, mom's just being herself, suddenly they're barking at you. There might be a decrease in activities. So you might notice that usually they love chatting with their friends. Suddenly it's not that important. They get easily tired, so they're constantly tired with usual day-to-day activities, nothing different that they're doing. You might find they're having thoughts about death. So it could even be something simplistic as, I wish I wasn't born, or I wish so-and-so just didn't exist. In certain cases you might find cutting behavior, you might find substance abuse increasing. Mostly this would be among teenagers. And now when we come to normal symptomology, you're looking at low mood for most of the day for a period of at least 2 weeks. You're looking at feelings of hopelessness, nothing is ever going to get better. Helplessness, there's nothing I can do to change my situation. And worthlessness, no one will even notice if I'm gone, for example. And you might find that they have crying spells. Again, it seems apparent for no apparent reason that they're having these crying spells. You might find anhedonia, that's a loss of interest in things that they usually enjoy. You might find changes in appetite, changes in sleep pattern, increase or decrease. So when it comes to appetite and sleep, it could go either way. So don't assume that just because your child is sleeping more, that means there's no issue. an excessive amount also could lead to depression. So when you're looking at this, you have to remember it's a group of symptoms, not just one simple incident. So for example, when you're looking at diagnosing depression, it's a group of symptoms that have existed for a minimum of 2 weeks, not shorter than that. So that's how you would primarily differentiate between normal teenage angst, laziness, misbehavior, etc., or low mood, because all of us have low mood at some point or the other, versus depression. It has to be there for minimum of 2 weeks continuously most of the time. Next, it's important to also, if you feel that something is amiss, it's important to trust your gut. You as a parent know what your child is going through, what they're most likely to be feeling, so it's important that you ask. Now, a lot of parents are scared to ask about suicidal ideations. How do I ask my child? Maybe it'll put a thought into their heads. No, it won't. But it will open the channel for you to have a clear discussion about it. When you have a clear, open discussion about these things, it allows the child to know that mom and dad are comfortable with this. If I have a problem, I can turn to them, I can ask for help, and they will turn around and give it to me rather than a lecture. So it's important that you create the channels, you create the space where they can talk to you openly about any of these concerns. This will also hopefully help you preempt a situation which you're not looking at. So in severe depression, for example, or suicidal attempt, for example, you could hopefully prevent it. However, it is not your fault if something does happen. Next, now we figure out, okay, so-and-so child does have depression. Now what do we do next? So the next situation is just the basics. Let's start off with, make sure there's adequate sleep. About 8 hours for children, and most teenagers will require about 9 to 10 hours of sleep because their brains have just started developing, their frontal lobe is developing at this point, so they do require a little bit more sleep than most of us adults. So I'm sure most of you will feel, my teenagers just constantly wanting to sleep. It's okay, 9 to 10 hours is okay for them. Make sure that they have enough exercise, give them good nutritious food to eat, make sure there's quality time as a family. Usually quality time is again something that's important to make sure that it's gadget free, because a lot of times now our quality time is mostly, okay, let's all sit together and let's all play on our phones. No, let's keep it open where again conversation can happen. Another thing that you can look at is volunteering. So volunteering allows a feeling of community, it allows a feeling of purpose, that I'm doing something to help somebody. If I can help somebody else, by default I'm not worthless. So again, you're combating those feelings of loneliness, feelings of worthlessness, feelings of hopelessness in certain situations depending on where you're volunteering. Also, the research has found that when I do something good for somebody else, I feel better, my stress levels reduce, and by default, if you see me happy, you'll turn around and look at somebody else and smile, and we pass on that cycle of happiness. So hopefully that's a good look at, but that again depends whether your child enjoys it or not. Don't force your child to do things that they don't normally enjoy. Try and look at what their areas of interest are and then focus on that. So combat isolation. Try and increase the connections that they have. Try and increase the connectivity with family, friends, extended. Maybe use this time to help them, and especially now during lockdown it might be a little easier because everyone's online. So maybe family and friends that they haven't spoken to, allow them to create that bigger circle around them so that they feel more supported. Again, avoid people who might not make them feel that good. Now the thing is, when you look at the older children and teenagers, they may not necessarily appear very open to help. They may appear to push you away. They may appear to say, Mom, I really don't want your help. I'm perfectly fine without it. Or they might storm off. But remember that is just their inability to express what they're going through. So give them that space, but at the same time go back and let them know that you're there for them. That if they need anything, if they don't want to talk now, that's fine, but you're there later. So keep the without making them feel pressured, keep that system going. The other thing that you have to remember is that the temper tantrums, the anger outbursts, the irritability, the misbehavior in that sense, it can seem a little personal at times. So you have to remember it's not personal. They're not trying to demean you, they're not trying to be rude to you. The idea is just that is how they're getting rid of their frustration. So remember, it's a depression talking, it's not your child talking. So don't at that point yell back. Try and be as calm, as patient as you can. Try and be empathetic, listen actively. Active listening is basically listening without needing to react. You're responding to them rather than reacting. The other thing is, next, consult a mental health professional. A lot of times parents feel that no, they have friends, they don't need a therapist, they don't need a psychologist, they're perfectly fine on their own, they'll manage, it'll get better soon. The problem is, as time goes by, it worsens the prognosis. The earlier therapy starts, the easier it is to deal with it faster. So therefore, don't waste time. If you find that your child has the symptoms of depression, please consult a mental health professional. Normalize the experience for them. Now see, this whole period is very difficult for your child as well as for you. As family, it's hard to accept that this is happening. There's a lot of questions that you might have. Why is it happening? Is it because of me? Except in cases of maybe abuse and neglect, it's usually not anything to do with you. It's just to do with circumstances. It could be with the child's coping ability. It could be genetic factors. There could be a multiple number of reasons. It's neurotransmitters, anything. So don't blame yourself. Remind yourself that you have to be strong for her or him, and you need to help them get through it at the same time yourself. The best way to do that is to educate yourself about depression, about the treatment process, about the difference between a counselor, a therapist, a psychologist, a clinical psychologist, and a psychiatrist. Then you can explain it to your child. Involve your child in this process. See, the mistake most of us parents make is that we feel we know best. But especially for older children and teens, they also feel they know best, and they definitely feel they know more than you. So what you need to do is try and involve them in the process. When you're looking at therapists, it's important to find a good therapist and client relationship. So when you're looking at that relationship, allow your child to be part of it so they know if they're comfortable or not. If they're not comfortable, they're not going to follow through, they're not going to work on it, you're not going to see that much of an improvement. Of course, that having said that, give them some time, at least a few sessions, because the first session is usually just history taking. So give them that space. It's important that when it's children, you might play therapy might work better. When it's teenagers, cognitive behavior therapy or CBT might work better. So again, the kind of therapy that you're looking at will differ based on age, will differ based on your child, will differ based on what you're all comfortable with. So that's again something you need to look into. You need to remember that depression is something which affects not just the individual, that is your child, but also the rest of the family. So you, your husband, your other children, all of them are equally affected. Not as much as the client, but in your own ways. So it's important to also look after yourselves. Make sure that the other children are not as affected. Make sure you're looking after yourself and your child. Thank you and take care.